this lecture, guys, I am going to teach you PSM. Yes, I am an ophthalmologist, yes, but I am going to teach you PSM. Yes, I have to teach you a little bit of PSM, but very little, guys. So we are basically discussing community ophthalmology. We need to discuss three things here. Number one is the program, national program. Yes. Then secondly, something called as Vision 2020. All of us have heard. And thirdly, school eye screening program. Okay. So that's a little bit of PSM related to your ophthalmology. I start with NPCB. As you can see the symbol, everybody, this is the symbol for the National Program for Control of Blindness. But alas, this is the old name. The new name has expanded itself and become NPCBVI. The symbol still remains the same. The symbol is still like this, everybody. So this is the symbol for the program, but the name of the program is NPCBVI. What is the full form, everybody? National Program for Control of Blindness and Visual Impairment. So these two letters have been added, VI and visual impairment, right? So after we know the name of the program, what we need to know is the definition of blindness. So the definition of blindness according to NPCBVI is presenting visual acuity less than 3/60 in better eye, okay, or visual field limitation to less than 10 degrees. Am I clear? Earlier, if you have read the older definition which was valid till 2017, it used to be less than 6/60. Now it is less than 3/60. And it is less than 10 degrees. Earlier it used to be less than 20 degrees. This definition is now same as definition by WHO. Okay. So the WHO definition has now basically been adopted by India. Am I absolutely clear? Now, our prevalence of blindness in India last measured was 1.05%. Okay, everybody? But if we will measure it according to the new definition, then it will become lower, everybody. Because earlier the cutoff was less than 6/60, now the cutoff is less than 3/60. So a lot of patients which were earlier classified as blind will now not be blind. Am I clear to everybody? It is almost expected that it will become around 0.33 or 0.4%. Done? Apart from this, what we should know is what is the main cause of blindness? Number one, everybody, the most common cause of blindness is cataract. 62.6% of total cases are due to cataract. The second cause is refractive errors. Around 19.7% cases are due to refractory errors. The third common cause is glaucoma at 5.8%. Okay, there are lots of other causes also. I'm just restricting myself to these three important causes of blindness in India. That's my small discussion on National Program for Control of Blindness and Visual Impairment. New name, new definition. Those are the two main important things that you need to learn and answer. Now, after NPCBVI, let's move on to the second topic in community ophthalmology, that is Vision 2020. Vision 2020, what is the aim of this program, everybody? See, 2020 has two things. Number one, this program said that by the year 2020, in this year, everybody, that the prevalence of blindness should be reduced. That means the patient should have normal vision. Normal vision is 6/6 in meters or 20/20 in feet. So 20/20 vision in 2020 year. So the aim was, number one, to reduce blind people to a total of 25 million, or I can say 2.5 crore by 2020, year 2020. And secondly, to eliminate avoidable blindness by 2020. Avoidable means something which can be prevented, like cataract, everybody. If cataract is treated on time, everybody, surgery is done on time, it will never lead to blindness, everybody. Okay, so avoidable blindness, everybody, should have been eliminated, but both these goals have not been able to be met by now. Now, this was launched in the year 1999 in Geneva, but India adopted it in 2001 at Goa. Okay, everybody. Now, there is a basic difference between the diseases that are covered globally under Vision 2020 and in India, everybody. Okay, so what we need to know are diseases covered in India, first of all. So in India, there are 7 diseases which are covered. Okay, so let's list them. Number 1, cataract, most common cause, obviously. Number 2, refractory errors, second most common cause. Number 3, everybody, glaucoma, third most common cause. Number 4, everybody, corneal blindness. Number 5, childhood blindness. Number 6, a very important disease, trachoma. And lastly, everybody, diabetic retinopathy. These are the 7 important diseases which are covered under India. But in globally, in the world, if I say, globally what is covered, everybody? Number 1, yes. Number 2, yes. Number 3, not covered. Number 4, not covered. Number 5, yes. Number 6, yes. And then as number 7, there is a different disease, onchocerciasis. So globally, there are only 5 diseases, if you understand, everybody. Number 1, cataract. Number 2, refractory errors. Then there is childhood blindness. Then there is trachoma, and then onchocerciasis. Okay, everybody. So 5 diseases globally and 7 diseases in India. Actually, in 2000, when the program started in India, there were only 6 diseases covered. Glaucoma was the last disease covered under Vision 2020. Okay, so this was the last disease that was added later on under the program Vision 2020. I hope we are clear about this. Right, guys? Done? Now, Vision 2020 has given us a pyramid of structure of how to go about achieving these aims. Yes? So, we can draw the pyramid like this. At the top, everybody, we say apex. Apex institutions. There are only 2 apex institutions. And apex institutions, 1 per 50 crore. That is the kind of population that each apex should serve. Secondly comes, everybody, center of excellence. Please keep adding 1 0 and please keep subtracting 1 0. So number becomes 20, the population becomes, instead of 50 crore, 5 crore. As simple as that, everybody. Then third comes training centers. Again, add 1 0, subtract 1 0. 200, 1 per 50 lakh. After training center come service centers. 2000, 1 per 5 lakh. And after service center comes vision center. 20,000, 1 per 50,000. Am I clear, everybody? 1 0 added, 1 0 subtracted. That is how we proceed. No confusion? Now, vision center. Vision center, who needs to be there at the vision center, everybody? Paramedical ophthalmic staff. Basically an optometrist, right, guys? What is the paramedical ophthalmic staff going to do, everybody? The paramedical ophthalmic staff is going to give primary eye care, measure the vision at least. You understand? Service center, everybody. Service center is controlled by an ophthalmologist. Okay, an ophthalmologist, a qualified ophthalmologist, where at least cataract surgery is being done. Apart from all the other diagnoses and everything, at least cataract surgery is being done. Done. At training center is medical colleges. The name itself is telling you training, everybody. They have to impart education, everybody, and they have to do CMEs, everybody. So continued medical education along with all the surgeries possible. Then Center of Excellence. Center of Excellence is for research and laying the guidelines. Okay, everybody? And Apex. Apex is Apex. What is the Apex? RP Center in AIIMS. Okay, everybody? Rajendra Prasad Center of Excellence in AIIMS. That is the Apex. Am I clear to everybody? No confusion about this, I hope, everybody. Done? So this is just a basic pyramid. Please learn this. The easy part is the population and the number. The slightly difficult part is if you apply your head, you will still be able to learn. First of all, an optometrist, then an ophthalmologist, then a medical college, then strategizing, and then finally the Apex. Right, guys? Done? That's all about my simple Vision 2020 program. Now, moving to the last thing in community ophthalmology, everybody, school eye screening program. School eye screening program is done by obviously teachers, everybody in the school. Okay? This is aim is to cover children from 10 to 14 years. Basically standard 5 to standard 8. Okay, everybody? Done? One teacher per 150 students. They have to measure the vision by Snellen's chart, everybody. Okay? And then refer to PHC if vision is less than 6/9. That's it, as simple as that. Okay, this is the job of the school teacher, that they need to use a Snellen's chart, make the children read ABCD and find out the vision. Done? That's your school eye screening program. Nothing else, guys. That's how easy community ophthalmology is. Please do learn these simple facts. Please do answer these questions. Recently, the question was asked, the question which I have just told you, what was the last disease or the latest disease to be added under Vision 2020 program in India? And the answer was glaucoma to that, as I have already told you. Right, guys?